Okay, thank you so much for that introduction. And now, today, it's very heartening to see so many of you in this course. And I suppose you have been dealing mainly with patients who have pain and malignancy and cancer. And I'm not sure how much exposure you've had to geriatric patients, but today's talk will be mainly about the elderly and what difficulties they have in um, connecting to society, in being independent, and what we can do to actually improve that. And then I believe we have a case discussion about a very dependent elderly person, and we can apply some of the points that we have raised into that context. So may I then be allowed to share the screen, please?
You already have the access, ma'am. You can.
Okay. Okay. So I hope you can all see the screen, and I've just named it Vulnerabilities of the Elderly. And this slide actually shows you that the elderly are a very heterogeneous group. And this one shows you the heterogeneity. Some of them are very active, some of them are dependent, some of them are together, some of them are really sports people. And that's why this logo for the elderly is a little disappointing to me, because it only highlights dependency. So I just put this up to say that don't use this logo if you're dealing with elderly. And as you can see here, some happy people, intergenerational connection here. I think this is such a nice picture. And here, enjoying childish activities. But I would like to draw your attention to this chap over here, who's Humpty Dumpty from our childhood days. And he always looks very happy. He's sitting on this wall. And it's a misplaced happiness, if I might say so, because he's actually very vulnerable. An ill wind could topple him, and he's very fragile, the elderly person, or she's very fragile. And there's, all the king's horses and all the king's men are required to really catch Humpty Dumpty, otherwise they cannot put him together. And who are all these king's men and king's horses? Well, that's us. Okay, that's us in terms of people who are interested in volunteering to look after the elderly, in the healthcare professionals, the families. So we have to see, one, that Humpty Dumpty is steady and smiling. And should there be something which tries to topple, we must prevent that. So what do we mean when we say that a person is aging? Every part of us ages. The body, as you can see here, there's impaired functional capacity in every aspect, physical aspect, and right down to activities of daily living. So there is a spectrum. Some are completely bedbound, others, as you saw, are very agile. And what makes this difference? That is the enigma which science has to unravel. How people, their chronological age may be the same. You may have 50, 90-year-olds. Nowadays, we talk of 90-year-olds. But one person behaves like a 70-year-old. That means biologically, his age is only 70. Whereas another 90-year-old would be completely bedbound. And now they're beginning to call these people who are so fit in the older age group super agers. So they're trying to look into these super agers and see what makes them tick. Is it their genes, their nature, or the nurture? Is it the environment? So that's an area of active research right now to find out, is it the genes? If it's the genes, you can't do anything about it. But usually genes have only 35% of an impact on a person, and it's 65% is the environment. So which means there's a huge area that we can exploit in terms of nutrition, exercise, looking after the different diseases that elderly people get, and try to make them as best as possible so that the whole focus now for the WHO, United Nations, is active aging. This is the decade of healthy aging. So you may be chronologically old, but can you remain biologically young as much as is possible? So so much for the body, but the mind also changes. Our ideas, the things that we want, the things that we need, they are two different things. Things that we desire. What do we really want to achieve? How do we feel in our mood? How is our memory? So these are all different aspects of the mind, which also ages as we grow older. And then, of course, we would be remiss if we did not mention the soul, the spiritual aspect, faith, our thoughts about the afterlife. That is something which I don't feel I'm very able to talk about today. And that is something which, let's see if we can get some inputs from all of you about it. And of course, for everything. So all these different aspects of each individual changes to a different degree in different people. And this is a terrible slide. It's really awful. One person, when I showed this slide, they said, my goodness, you bombarded us with all these things. But these are the geriatric syndromes. What are the things that can go wrong with your body and can affect you and your mind? So there's hearing impairment. We all know that. Usually people who are hearing impaired will never admit it. And if it's a man who's hearing impaired, the wife can shout, but he'll say, I heard you the first time. So, then there's intellectual, we talked about impairment, memory, vision, very important. Nowadays, the visual part of it can be so, the most common cause, such as cataract, is so wonderfully done with this new technique of phacoemulsion and the intraocular lens. But I still remember when I was a child that my grandfather had these horrible soda water bottle glasses and he couldn't even walk properly. And we've come a long way with vision, but there are many other visual problems which cannot be solved. And this is a real impairment as you grow old. Inanition, just not being able to do anything, bored, low energy. This refers to stool impaction. Incontinence is so common and so disabling and so reducing the dignity of a person. Then, of course, ability to fight infections. The immune system comes down. So this is all at random. I'm not no order. And because of this, there is a lot of infection, especially lung infection, urinary infection, which can suddenly make a somewhat, Humpty Dumpty sitting on the wall just crash down and then has to be brought up if possible, otherwise, no. Sleep. One of the things that really disturbs people with no freshness in the morning is a very low sleep. Most people sleep older age only sleep 4 to 5 hours, but older people need 6 to 7 hours. It need not be a continuous sleep, even if it's broken, but it should be a good depth of sleep. People, because of their musculoskeletal problem, they've got a hip joint pain, knee joint pain, foot problems, not able to move around, not able to exercise, and therefore overweight and a general feeling of not being well. And this is a rather large word, big word, iatrogenesis, and this really refers to people, to doctors, the healthcare professionals who give a treatment and it goes wrong. So when a person suffers either the known side effects of a treatment or the doctor was just not aware that these are not drugs that you give to an older person because their body makeup metabolism has changed so much. And so this is a continuing area of, professional development that we keep doing to our doctors, that as the population is aging, you have to be more and more careful for your elders to cut down the number of drugs, make sure they don't interact, etc. Impotence, decreased sexual activity, libido in males and females, because of balance is so much affected, and bones and muscles are so weak. Falls is a very major issue, and that causes fractures, which then is usually the ends very badly for most people. They go downhill after they have a fracture. And so medical care is quite focused on making sure that we identify people who are likely to fall by various simple methods, and then give them corrective treatment if possible. This is the hope, but we fall far short of this. Elderly people get very isolated, again, because they are immobilized, because of the hearing impairment, vision. They feel isolated. Even if they have people around them, they may be still isolated. So this is a kind of a huge bunch of problems that elderly people have. And we think, oh, he can't control his urine because he's old. That's a completely wrong statement. You know, there's treatment for that. Yes, older people are more vulnerable to not being able to control this, that, and the other, or move around. But all these things can be either prevented or they can be ameliorated, not always cured. And, you know, taken all those physical aspects together, what are the psychological factors that affect people or are part of it? One is when you've been working all your life and contributing and part of a team, usually people feel very good about it. But when people retire, there's this sense of worthlessness, of being put on the heap, and they become very lonely. If they don't have a good pension plan, they could be very poor. They may be worried about the future. What is going to happen? Today is bad, tomorrow is worse. And then, because of all these factors, they're very vulnerable to be abused in subtle ways or in obvious ways. They can be abused physically, financially, psychologically, various ways. And usually the abuse sadly comes from people who are around them. Not because people who are around them are bad people, but because there's a frustration with this old person who is perceived as being stubborn. I usually hear this word from younger people. My father is so stubborn. And I say, please don't ever use that word about an elderly person. They don't want to do the things that you want them to do. And so don't label it as stubborn, you see. So they get abused, they get shouted at. And then, of course, because they may not have good cognition, their finances may be taken away. So there are all many, many ways of abuse of the elderly. And then, of course, they are fearful of. And we have these bioethics, 4 principles of bioethics: autonomy, justice, benevolence, there should be null malfeasance. And if you look at it, an elderly person has very little autonomy because he's just not able to exert himself. Justice, there's a thing called ageism. He's old, so I don't think he needs to have this treatment. So because of age, when you deny somebody something, it's not justice. And then benevolence. Everything that is done for an older person should be for the good of that person. And everything that is done should make sure that it does not cause any problem. So all this is something that we are familiar with. But it's high time that we start thinking of older person a different way. And so the United Nations brought out a charter of older persons in 1990. And they put these 5 points, which are like the rights of older person. The Human Rights Declaration by the UN was made in 1948. But as people began to grow older, they realized that there was a need to have special rights for older people. And so they say they should have the right for independence, the right to participate in society. They should have the right to care of all kinds. They should have the right to fulfill themselves. If they want to learn a new language, if they want to travel, they should have the right for fulfilling their desires. And then lastly, but definitely not the least, dignity. So if you expand it, you'll feel many, many other rights are there. Look at this, right of freedom of thought, conscience, and religion, right not to be discriminated against. So you can study this and see that no matter how old you are, you have rights. How do we allow a person to get those rights? So active aging. Let the person age in an active way so that he retains all his faculties. And how does that happen? It doesn't happen by itself, by magic. Two important determinants are the culture that you live in and the gender that we are. We know that women live longer, but women are marginalized in all societies, including in India. And especially if a woman is a widow, she's even more looked down upon. So it depends upon gender and culture. And it depends upon the economic determinants, how rich or poor the person is. What is the access and level of health and social services that are available to this person? How is their behavior? How has it been before? What kind of society do they live in? What kind of person were they? Were they very well-balanced people, or were they very anxious? Do they have a mental illness? All kinds of personal determinants also will determine how actively this person can age. And then, of course, physical environments and society that the person lives in. So all these things have to work together to help the person to age in a very active and good manner. So if all that happens, if a person can age actively, we can remove the negative perception of older people. We perceive them as less valuable to society. We feel that they're dependent on the younger generation. They don't contribute to the economy, so they're a burden, they're non-productive members of society. Of course, their contribution will come down, but can it be different? They are seen as weak and frail. Their judgment and decision-making is not good enough, so they need to be protected. And so you can see, they may have. So these are all the negative ones. But supposing we shift it to an older person who has rights, is an active agent in society. They have skills, they can get new skills, they have knowledge, but more than knowledge, wisdom, and then they have experience. So can these different attributes which an older person has be used to remove the negative perception we have and have a more positive perception? So now, with this little background, I'm not going to go into the medical aspects. I've got three scenarios of three different types of elderly people. And just to show how different elderly people have different needs, have to be managed in different ways. So let's look at this 60 plus elderly frail widow. Not very old, you would say, but in India, a woman can be very biologically quite old at the age of 60. So she's frail, she's a widow, she's living in a village. She has to do daily manual work. And that is, she has to take her cow for grazing. And this actually happened when I was studying elderly people in the community. When we went to one of the houses that was allotted for our research, we found the lady was missing. And we waited for a while, and then she came with her cow, very, very tired, and said, well, I had to go out to feed the cow. Otherwise, how will I get the milk to feed me? And so, because the children have left, they have migrated to the town, and I am left here, I have to do this work. So she weeps and she says, I'm poor, I'm lonely, my knees can't carry me. And I just feel that they've left me and gone away. Abandonment. So how do we begin to help a person like this? Can we stop the rural-urban migration? We can, but not you and I individually. It has to happen in the country as a whole. Jobs in rural areas have to come. So there are some things that we can help with, there's some things that we can't. So that's a rural situation. Let's look at an urban area, upper class, okay? There's this 80-year-old couple, they have diabetes, heart failure, dementia. Together. One person may have diabetes, person may have heart failure and dementia. So they live in a retirement home. Nowadays, there are some very posh retirement homes, and both the children live in the US. Similar to what we saw in the rural lady, but for her, they had gone to the town from the village, and here we have a person whose family is overseas. And they tell, their narration is, I slipped and fell. My wife is too weak to lift me up. Our children can see us every minute through a webcam that is placed in the living room and bedroom, and they send us money. So you say, now, what's the problem? They've got a roof over their heads. They don't have to take a cow out into to graze to get their money. But they have illness, they have pain, they have disability, which is not always addressed by just having a webcam. Of course, people may come and look after them, but they're dependent. They don't have any autonomy. They cannot say, I want this. They have no rights. And in spite of all that they're getting, they still feel abandoned. And this virtual caring is what many upper class people suffer from, because the children are in different parts of the world and are unable to be actually there. And because of this webcam, they actually have a loss of privacy. Every moment, if somebody sitting thousands of miles away, even if your family are available to can see what you're doing, it's not good. So what's the solution? Well, we must improve the health services access so that these diseases are well cared for. The falls are prevented. People should be available to help them if they fell. Home care services. Every person cannot go to the hospital. In fact, it is now found out that elderly people, when they go to the hospital, they become worse. Their function decreases, they get infections. So the whole focus now is to how can we deliver the healthcare at the home so that you age at home, not in the hospital. All services should come to an elderly person at the home. We have to reorganize everything that we do for the older person to age at home. And then we have to build more long-term care homes. We don't have many of them in India. What we do have are either for the destitute or they are for a very well-off people. So the middle class, there aren't any long-term care facilities where older person is not institutionalized, but can live independent lives. All this requires money, organization, so that they can at least have all the services and not feel abandoned. So we'll think about that, but we can come to now an urban healthy couple. We talked about an urban sick couple. Let's say there's a healthy couple. There are many of elderly people who are quite healthy. So do they have a problem? Let's look at this one. This is a couple in their 70s. They're retired high school teachers. The man has a hearing impairment and the lady has arthritic knees and she is incontinent of urine. So they are living with their son, grandchildren, and daughter-in-law. And the family dynamics is okay. They don't have quarrels. They have good harmony. But if you talk to them and interview them, they say, we have everything we need, but we are not able to connect with the grandchildren. They live in a different world. They have online classes. They have phones. They have TV. They don't need us. The son and daughter-in-law are busy in their jobs. So we are actually living with them, but we're alone. So what does this mean? These are highly educated people, but they have a loss of purpose. They have a loss of connectedness. They cannot connect with their own family. No peer support. Educated, active people suddenly left without purposeful, enjoyable activities. So that's a terrible thing to happen. So what is the solution? Improve the social connectedness. Make sure that every older person is talking on the cell phone to somebody, meeting up with other people, so that the home is not the only orbit in which they function. What about mainstream life? Can retired people participate in mainstream life? Yes, they certainly can. They may have to change the type of work they do because of their physical disability, or change in their cognition, but they can participate in mainstream life. These teachers, you can think, what could they do? They could even go back to school and talk to, tell stories, may not teach something, or they could go to a library and help to be librarian. So many things they can do. And then, of course, family bonds have to be strengthened. So you can see here there are many things that can be done to have this connection. You hear actually some very difficult stories. This is a good story, and still there's a problem. I know of one person who the grandmother was very, very unhappy, and I said, but you've got your grandchildren. What are their names? How will I know their names? They're not allowed to come and talk to me because I'm not very clean, they say. So you see, all kinds of undercurrents will take place between generations. And as people who are helping, we have to understand some of these things. So I've given you 3 scenarios. And one of the things that I think is very, very important for older persons is the community participation. So, which I talked about in the last one, phone-in services. People can phone in and talk to them. Home care, long-term care services. Encourage peer support groups so that if you have parks where elderly people feel safe to go, if there are libraries, if there are eateries, if there are gyms, which are meant for older people and is a meeting ground. We know that in different countries, people meet each other socially in different places. In the village, it is the tea shop, the chai kadai, as we say. Well, it could be still the same thing. Now it could be parks, it could be eateries. And then, as I said, when generations are able to mix with each other, they have mutual respect in schools and colleges. Many of the colleges have something called adopt a grandparent. So the college student goes and talks every week to a particular person, to somebody whom they've adopted. And transport is very difficult for elderly people because after a certain period, you're not allowed to have a driving license. It's only the upper class people, rich people who can have cars and then even know how to drive. But our transport, our buses, you have to really climb Mount Everest to get into a bus. And somebody with an arthritic knees can't do it. So you have to have low floor buses. You can't have low floor buses if you have roads which are not good enough to support them. So trains are okay, but then you try going to the toilet if you're an older person in our Indian trains, it's quite a challenge. And then, of course, health services. Elderly people do require much more help than other people. And more, the world is trying to make them community-based health service so that they get it at their doorstep, and or at least in a community area, rather than have to go to a hospital. So, an example of a peer group. This is Help Age India, which is doing so much to in this particular area and in many other areas. So apparently there are 875 senior citizen associations across India, which is very little when you look at the huge number we have. And usually what you do is you have 5 to 6 people with similar interests. They must meet once a week, okay? So it could be anything. It could be that they just like to talk politics. It could be that they like to play cards, chess, whatever. So you meet and you look forward the whole week. It could just be to go for a walk. So some activity is chosen. And with this group, they can get companionship and emotional support, because in between you talk about my granddaughter is doing this and that. And so there's a lot of exchange of ideas. Very important that the elderly people are not poor. So mandatory old age pension schemes for all, including the informal sector. We have so many women who work as domestic helps. And do their employers take out an old age pension for them? No. So they have to live on their meager earnings. So it should be that every employer, even if it's in the informal sector, has to put away money for them. There are some schemes, but they're not well publicized. Strengthen the Maintenance of Parents and Senior Citizens Act. So we have a law in our country which says you have to maintain your parents. And if the parents put in a complaint about the child that they are taking away my money, they're not maintaining me, they can actually be pulled up. But very few people really use this law. There should be subsidized meals, subsidized medicines, and the banking systems. Older people may not be able to do the new electronic kind of net banking, etc. So it has to be made elder friendly. So I really like to conclude my talk, just giving you a very speedy bird's eye view of the dilemmas and vulnerabilities of elderly people in the health scenario, in the social areas, in the family areas. So we, in each person's, we have to identify the problems. And I think you have a case which you're going to present where if a person has a problem, you have to identify the specific problem. At a community level, what are the problems that are happening in the community? And then you have to do research to find a solution for that. And then policies have to be made. That it is the duty of the government and the administration, but to make out policies. We in India, we have in 1999 our first old age policy. And now that has been revised several times. And these policies should be such that it can be applicable over different sections of society. For example, we had travel concessions for elderly people in the railways. That has been removed now. So things like that, applicable to everybody. And community-based solutions may hold the answer to everything. And it is the government which has to recognize these needs. How will the government recognize this? It is civil society, you and me, who have to take up these issues and make it a political event, a political talking point, and bring policies and acts and laws which ensure that the rights of the older persons, as we've enunciated before, are looked after and upheld. So here are some pictures, happy pictures. This is the most wonderful picture I can see out here. And here are 4 decrepit men in a very, very, poor background. But they are actually quite happy because they have each other to support themselves. But they could be happier. And here's other people. They're disabled, but they're sharing a secret. Here, very healthy, in a very nice environment. This is how old age should be. So you continue to be part of society. So with that, I stop, and I'll stop sharing so that we can all talk and discuss. And any points anybody would like to raise, please, or their own experiences. Yes, please, Darshana. Would you like to speak? I thought you put up your hand, Darshana.
Aparna, I think, raised her hand.
Oh, Aparna. Please speak. Aparna.
Hi. Hi. So, in one of the classes I was in, they also taught about the media
Sorry, I can't
representation.
see you. I can't see you.
Oh, okay, just a second. Just a second.
Oh, you're up there. Okay.
Yeah.
Right.
Yeah. So, one of the classes I was in, they taught us about, it was a discussion about how the geriatric population is actually represented in the media, and which is a very pathetic representation. Like when you see ads and stuff, it's always like, oh, they don't know how to use technology, and it's the kid or the teenage who has to teach them how to do it. And just in general, if you see serials, especially Indian serials, the older people are just like all the older people are aggressive. They just want everybody to be unhappy, and so certain portrayals and so media representation is very powerful. So it's like the public, as well as even the people who are portraying the geriatric population that way, more than, like, I wouldn't say more than the policies, but then before the policies, that is a more doable and immediate action we can take on how the public or people view geriatric population.
You're right. You're right. Yes, it's how we perceive. But then that is a reality. It is very sad because as you grew older in those days, you were the font of all wisdom. People came to you, and now older people are suddenly find that they don't know anything. It is a young person. You know how humiliating that is. To a certain extent, it was always like that because the world changed, but you didn't change as you grew older. And so somebody had to help you. I remember my father, whom I was, looked up to so much. And then he couldn't do so many things. And I had to say, no, it's not done like this anymore. It's done like this. And he said, oh, really? And and you think to yourself sometimes, I put the diapers for this person. And now she tells me how to order this and that from Amazon. And but so there has to be a way to change that. Older people must be taught how to do that. Who will do that? Community has to do it. They have to be energized and not made that it's all mumbo jumbo. But you brought up a very, very important point. Firdaus would like to say something.
Yes, ma'am. Good evening. Thank you for the wonderful session. I could connect with you very well because I work for a geriatric care center, and I see this very often when the families come, especially a husband and wife, and one of them is like in a state that they have to be brought to a centers for some services, maybe it is dementia or any other post-operative care, and the other couple is left alone at home because the children stay abroad, and the kind of loneliness that creeps in post that, it's very difficult for the other couple to go through this detachment phase. And so in India, I think people are realizing the importance of geriatric population, because until now it was a population which was neglected. We never felt that they also come under the spectrum that they require mental health care and physical health care. And even though they're aging, it has to be active aging, as you said. It has to be a happy aging, according to me. And there are some centers, like one of my center that I work with, we have concepts of daycare, wherein active elders come, they spend some good amount of time with us. They can come with their couples, husband and wife together, and we have group of cognitive activities, group therapy sessions, music, art, a lot of it. And I see a lot of change in terms of their mood, their perception towards life, because we do some kind of assessment pre and post.
They're connected. They get connected.
They're connected, and they find sort of a purpose in life, because as you rightly said, that a lot of purpose is taken away from them as they age. The autonomy is taken away. And when a person's autonomy is taken away from you, you feel there is no fulfillment in the kind of life you're leading. So this kind of setups, like you wake up in the morning, there is a purpose. It gives you a purpose to wake up in the morning, get rest, wear good clothes, come to a center, so that you can meet your other new friends who come from various different societies. And
perhaps, if I might just interrupt you there, it
yes,
cannot be an institutional center. It could be in society. So if people get this idea that, we five of us can meet together every week and do this. I know one family who retired, a man retired early, and before he retired, he says, he was a doctor, and he said, on Mondays, I'm walking with the ENT and the gastroenterologist. On Tuesday, I'm playing tennis. And on Wednesday, I'm doing this. So his whole day was completely charted. And what do you do in the evenings? I asked. Oh, we watch movies from the 1950s. So you see, this is what you're doing is you're showing a model. And that model, if it can be expanded, so they don't have to come to a center. But certainly if they are disabled and they don't have any these things, you can certainly. I'm so happy to know which city exactly are you in, Firdaus?
This is from Bangalore.
Okay, Bangalore. Bangalore has got everything. I wish somebody would come to go to other places also. You know, you've got the Nightingale Society. Are you with Nightingale or you have your own?
No, this is a separate one.
Very
Yeah,
nice. So nice.
associated.
So nice to hear your work. And
Yeah, there is something called buddy system. If a lot of elders are looking for, it's like, as you spoke about, intergenerational connection. So we found out that our elders connect very well with the youngsters, especially the one in the early 20s. And there's something called buddy system, wherein volunteers from various colleges, they come and they spend some good amount of time just to probably take them to a supermarket or take them to a bank to help them, to aid them with some technical issues, because if they are not tech savvy, so they can help them. So
and
these
I
kind
hope
of
that
new
in that
concepts are
process,
coming.
in that process,
No, yeah, yeah,
they
yeah.
teach them to do everything themselves.
Yes,
You know, very often I find that people who are
yes.
helping, they do it for them. Don't do it for them, you know.
Mhm.
Make them do it. So give them the independence. Old people, it may take longer because, you know, we all know that the neurons are falling out or the synapses are much less. So you give, anyone else would like to share? Yes, please, Indra.
Thank you.
You have to unmute yourself. Yeah.
Yes, hello. That was a very, very enlightening session. Thank you so much. I actually want to begin by talking a bit about my mother, who I used to care for long distance. And when the cell phone came and I gave her one, she was very happy because she was a great speaker on, I mean, she loved talking on the phone. So I told her, since we had certain incidents when the phone doesn't go through, but the text does, I tried to teach her to text. So after some time, she said, how many things do you expect me to learn at this age? It's fine, you know. And then this always bothered me because I used to feel if I can't get in touch with her and I live in another city, I'd call the neighbor, just go and check. She hasn't called today, etc. And then in the UK, I met a friend. She and her husband, every Sunday in the community center, they gathered the elderly, and they said they bring their devices, which they don't know how to use. And they help them learn the iPad, the phone. And I said, you know, I wish we have something like this within the community so that they begin to learn.
Yeah.
And this friend told me, of course, she said, you know, with all our efforts of teaching them, there's so many things you don't quite say because you feel they should know it. She said, I was visiting one of these elderly women, and this is in Chesterfield. And she said, I just overheard her giving something like a number out. And I said, what did you just do? Who did you give that? What number is that? She said, oh, it's my, don't worry, dear, this is my, you know, my credit card number.
Oh.
And she said, what did you do? Oh, my internet isn't working. So I just gave this man, he's fixing it for me. I said, do you know him? No. So she said, let's call your bank, let's call your service and just stop this, you know?
So yeah, there
And
are
she
many,
did.
many pitfalls like.
And she
But,
said,
you
you know,
know,
we didn't realize that we were not teaching one thing about not trusting anybody. Now that you know how to use some things, you must check
so
something.
many aspects. One of the
Yes.
things that you were talking about, I don't know about you, but I feel that a person who is slow to learn, for example, I was slow to learn to drive a car. I think I'm a very good teacher for somebody who's beginning to learn, because good drivers, they just expect you to know everything. Whereas a bad driver knows why it's so difficult to do the steering and I'm not talking about the automatic cars, and do all this together and can better teach. So I don't know whether there's a way of looking at those who perform the worst and giving them the top rank to be the best teachers.
That's such a good idea.
But that's what I thought.
But I think,
You
yeah,
have-
but I think these devices, we have to find ways of teaching them slowly and, getting them.
And now, of course, with the touch screen, but again, the touch screen is not good enough for people whose finger movements are not good. So
Mhm.
they have to, but you do get big ones now, big
Yes,
tablets and
yes,
stuff. So
yes.
it'll take the tech companies a while to realize that they've got a huge market in elderly people and they better
Yeah.
have
And the
better
voice, I
device.
mean, to use the voice,
Yes, yes, yes.
all
Rather
of
than-
that.
Yes,
Yeah.
voice recognition rather than,
Mm.
They should get
Yes, yes,
elderly to experience this. The company toppers should get elderly to experience this, and then they will modify us.
So how much time do we have, or should we go on to our case? Can moderators tell us? It's 3:48, or if anybody, yes, Priya, can we have a little
Actually,
bit?
we do not have a moderator for our FCPC
Okay.
course this batch, so it is
Yeah,
up
so-
to you. If you
Okay.
are, if you
Maybe
want to,
at 4 o'clock we can do the case presentation because it ends by. So we have a few minutes more. Anyone else would like to share something about?
Ma'am, can
Yes.
you dwell upon this Senior Citizen Act of 2007 a bit more?
It's a maintenance of the Parents Act. I think it's 2007. I hope I haven't got it wrong. Yeah, in which it's a law. If you do not provide for your elderly parents, then you can be fined. You can be, I don't know what the penalties are, whether you can be jailed, I don't know, but somebody has to complain about you. And I remember motivating, it's a very sad thing to do, but I remember motivating one old lady who was in my consulting room crying because she said, I have such a bad back pain. And so I said, oh, is it? Let's see. But she could walk and she could go up to the couch. And so I knew, because I have such a bad back, there must be something else, which is making her cry. And it came out. I handed over, I did a settlement deed of my house in Bombay to my children who are living abroad. And now they've said, we are selling the house. You please move out into an old age home. And they were shocked. They said, how? You're evicting us? They said, yeah, because now you put it in our names. We have to pay so much of tax. It's in our name, whatever it is. We are sending you to this old age home. So obviously, the back pain was just a reason for her to, seek help. It was a cry of help. So I told her there is this act, this thing, and I don't know what came of it. It's very hard to do this, but I did tell the people who were in her home that see whether she can get something done for her. So this act is there, but just like the Dowry Act, it's rarely used because within families, people don't like to take your own family to court, but at least there's an act. So should there be some problem, you can use it.
So you approach the police or you go for
No,
the legal
no,
advice?
legal.
Okay,
Not the police directly.
thank you.
You don't want to be so, that'll open up a can of worms. The same thing happens when you have domestic violence in a younger couple. The same thing happens when you have abuse of an elder. As a doctor, I have suspected abuse because there are some signs in people. But if you directly confront, it is the carer. This person has only got one carer. The carer is abusing that person. It's sometimes not the fault of the carer. The carer is distraught. There is no respite. She cannot handle this old person. So she whacks her. She's rude to her. Now, you cannot condone it, but you can understand the situation. But you can't demoralize that carer. So you have to do it in very, very subtle ways. So, you cannot report it to the police because now they lose the only carer they have. So it's a very, very difficult situation when it comes to elderly people. You have to use all your mental faculties and your, understanding of the situation, but you have to help in some way. That was a very important point. Yes, anyone else? Okay. If not, then should we move on to the case presentation that we have? Do we know who's going to present it?
Yes, we have Nidhi joining us. Nidhi?
Good evening. Am I audible?
Nidhi?
Am I audible?
Yes,
Yes.
you are.
Okay. Can I start the presentation? Good evening, all. Myself, Nidhi. I'm a postgraduate student in social work. Today, I'm going to take the presentation based on the topic elderly and vulnerability. And here, my patient about the patient overview. The patient has age 72 years old. She's a female and diagnosed with frailty and Alzheimer's. She's a housewife. Her medical history diagnosis is a frailty due to old age and Alzheimer's. Since at the age of 70, she is suffering from Alzheimer's, partially bedbound, and food intake is comparatively less as compared to before at the diagnosis stage. Mobility and physical activities decrease due to frailty. Some exercise programs tailored to patient capability have helped to manage the frailty. Insight on the based on diagnosis, patient is not aware, but the family knows about the condition through doctors. And the case of prognosis, patient is also not aware about the prognosis. The caretaker and the family members knows and accept the prognosis. And about the palliative care, also patient is not aware. Family, they were more aware about it. And this is a family overview. Patient's husband has been died. Patient is 72 years old. She has two daughters. Elder daughter is 55 years old and younger daughter is 50 years old. They both of them are married. The patient is now living with her elder daughter. Elder daughter also had one daughter and one son. They are also married. Younger daughter is also married and they have a child. The 72-year-old woman living with frailty and Alzheimer's after losing her husband resides with her elder daughter and husband. The elder daughter and her husband take on the role of primary caregivers, managing their own family responsibilities alongside for her. So the woman's grandchildren offer occasional emotional support. Her younger daughter does not contribute to her care and is financially exploiting her, causing strain within the family. This situation adds financial pressure, emotional stress, and potential conflicts. Despite these challenges, the elder daughter's family remains committed to providing the best care possible, seeking support from the extended family and community resources. And this is a echo map. From the patient has a strong relationship between the hospital and the local council in which the patient has a monthly regular routine checkup with the nearby hospital, a private hospital. And it's a patient has also a strong relationship with the local council because during a few years back, she doesn't has their own house. So with the help of the local council panchayat, they build her a house and they have a strong relationship with the patient and the friends. In case of friends and relatives, they have a positive relation and they cares and they cares about her condition. In case of religion, she has a stressful relationship, and in case of her pension, she has a old age she's getting a old age pension, but it is from 6 months onwards, it's that had a drop because our government is not now from 6 months not providing the old age pension, so the pension is now not getting around 6 months. Socioeconomic overview. The primary breadwinner of the family is her elder daughter's husband by doing coolie job. She lives with her elder daughter. Despite owning a rundown home, the community and local authorities collaborated to build a new one, improving their living conditions. Unfortunately, her children show little interest in her well-being. One daughter takes on the responsibilities on caring her for mother diligently, while the other neglects her needs. To exacerbate matters, the younger daughter exploited her mother's finances, adding to elder woman's vulnerability and lack of support. The ration card is BPL, pink color, and are not met to their monthly needs. All this pension need is not getting around 6 months. The total expense of the family is not enough to meeting all needs of the whole family. And psychological overview, she is experiencing frustration and anxiety due to the memory loss and declining physical health. She feels a loss of independence and identity. And it's about total pain. From a physical aspect, she's facing arthritis and a muscle weakness. This is why because she's facing frailty. And in the psychological issues, she has some behavioral issues, emotional distress, loss of memories, frustration, etc. In socio-economic aspect, she has financial crisis and social isolation. And in spiritual aspect, loss of faith in life and no hope. And the discussion points I think so access to healthcare, the impacts of social connection and overall well-being, supporting living environment, financial stability, emotional support to caregivers, caregiver responsibility, and vocational training for the caregiver for maintaining their family income and to manage the family expenses. And the plans are the assessment, caregiver support, financial assistance, emotional support, follow-up to facilitate old age pension. That's all about the presentation.
Thank you. Thank you very much. Now, actually the whole case has been discussed already, but we have to, those are just the bare bones of it. Okay. How exactly in this very difficult situation can somebody help? Already we have seen that there is help from the local council, they say. So is it the panchayat? They're living in a village probably. The panchayat people have got together and help them to improve their housing, which is a very, very great thing indeed. And I think the local panchayat should be able to help people who are she's a widow, but then the family situation is very poor. So how would you, and then they have this conflict between one daughter. I don't know, you presented that the daughter is taking away her finances. There doesn't seem to be any finances that this older lady has. Neither is she getting her pension, and she has to be supported. So I don't know what kind of finances she has, but it could be that she had some gold or something like that. And the daughter, in India, we are so much into our gold, what we have. Maybe she's demanding some of that. I don't know. So how would anybody be able to help the situation? One is, of course, to understand the situation, to empathize with them. And we, as an outsider, cannot really give directions, but you can empower the people to help the situation. Anyone got any ideas about this? How would you help to bring the family together so that there is double the support? And if nobody has an idea, Nidhi, we're going to ask you as a social worker to help us out on this. How would you bring different two warring factions together? Yes, anyone? So this is actually the crux of the problem, the family dynamics. And this must have started a long time before. The family feuds may be there for a long time, some kind of jealousy, some kind of a feeling that I'm getting less or I'm getting more. It may have something to do with the individual person's personality, or it could be a long-standing family feud. So who is the person who's going to tackle this? Is it a healthcare professional? Is it civil society? Is it neighbors? I think that is a problem. But certainly you can bring people together if you make them both feel that they have a responsibility together and that one is not duping the other. That's the only way I can think. So I can see that this can help. And here is where a family discussion is very useful. Anyone's been taken part in a family discussion to show how useful it is or how futile it is? Yes, is that Anita Sarkar who wants to, Shankar who wants to? I thought you put your hand up. No? If anyone's put their hand up, please unmute because I can't really see. Anyone offer a solution? Maybe none of us are in this particular solution. There's this particular problem of a very poor, impoverished family, but the same things can happen in an urban setting in well-off. where only one person takes the load and the other person is just putting spokes in the wheel. So I think if that can get together, it has to be an enabling environment. I also found that it also is a determinant if the person himself or herself was a difficult person to deal with, a cantankerous person. Now, we never like to blame the patient for anything. But I remember one family situation where the husband, the son-in-law, would be there in the family discussion and say, "This man is so horrible. Imagine he expects his daughter to help him to evacuate the stool. She's a lady. How can she, disimpact the stool? But she's doing it. I don't like my wife to do this thing." So you see, it was a bizarre situation, but it happens. Somebody has to help the old man to do this. And there's nothing wrong if the daughter does it, but it was disturbing him. And he said, "This man is very, very cantankerous, and now this serves him right to have this kind of a situation." So you as an outsider would have to not take sides. You have to show up the people that, this older person needs the help. How do we together go around and do it? And lots of family jealousies, especially when they know that the old person has got some wealth. So wealth, money, land always adds problem in any situation. And we have to be aware of that. I know some people who the whole family would come to my office and say, "How is that old man doing? He is such a horrible man. He's got all his money. He's not writing his will." Okay. And then when I went to see them in the ward and this whole family was there, it was a completely different thing. There was sugar and spice and, how do you want this? Do you want that? Because they were all after something that this man had. So, very different family dynamics can be there, which as health professionals, we have to know the undercurrents. But coming to other issues, for example, Alzheimer's. Now, Alzheimer's, as we all know, is a very, very difficult disease because we don't know the treatments. We're just beginning to understand what is the pathology there. And even though we don't have something to turn the wheel back or turn the clock back and bring back the cognition of this person, we can do a lot to actually care for these people because they have a lot of behavioral, a lot of psychological disorders, and they may be difficult to manage. They get lost, they go out of the house. In the night, they are awake, it's known as sundowning, and they cause a lot of distress to the whole family. And the family gets worn out and fed up. This is where health professionals can help them to understand. When a person is behaving like this, there's something troubling them, but they don't know what it is. They can't tell you. So there's a lot of work and study around how to deal with these people. And then if all else fails, you might have to sedate them, but we don't like to do that. So we like to try to get behind that mask and try to understand what they want. So there are various techniques. And unfortunately, in India, we don't have that. I've seen in the UK, they've taken this to a very good art, and they have so many sessions on how to deal with these behavioral disorders. So Alzheimer's is a very difficult disease to treat. The other thing that this patient has was frailty, and frailty is a very, again, a disease which health with doctors don't know about, researchers don't know about. For some reason, even though they may be healthy otherwise, they lose their muscle mass. It's called sarcopenia. They become thin and frail. They walk slowly. They lose weight, and they kind of melt away. And it's a kind of, people feel an inflammation in all the body organs without having a disease. Now, if you have cancer or if you have heart failure, you will become weak and slow. But when we say frailty, we mean weak and slow without any reason, just due to age. But there are things. So this patient presents a medical problem for which there's no treatments. And in a poor background, it's difficult to manage. but still it can be managed, but by social workers and health professionals to do make the even though the person has arthritis, as was mentioned, how to keep this person mobile. One of the things in elderly people is don't allow them to stop moving. Just make them keep moving. And music is something so wonderful. So if there was in this very impoverished background some way by which this person could meet other people, and music, I've seen one video, it was actually a video from the UK, where Bollywood movies, songs were being played, and all these old people with dementia somehow were swaying to it, and in that found a rhythm, and they looked happy, at least for the moment. So there are a lot of these unexplored things, or they're being explored till we find the treatment. Even if we find the treatment, it's not going to work like magic. And there are going to be people who are well advanced. So the medical aspect, old age should not be medicalized. There's a lot of behavioral concepts and all that we have to do. And this carer has to have a respite. One daughter, she's doing a good job, but she's also probably getting irritated and angry with her sister. And they're having feuds. So third parties have to come in. Anyone's been in a similar situation or knows about a similar situation, and what your dilemma was and how you think it can be applied in this case? Yes.
If you're talking about geriatrics with dementia, how, especially when it is accompanied with behavioral issues, there are different interventions that really helps. One is putting them in a routine. Routine really helps, and it makes the caregiver also a headspace to do their functions more effectively. And it is a very draining process. Like, it's mentally draining plus physically draining for the caretaker. So a routine alongside, there are some cognitive activities that can be placed, and some music. At the same time, art-based therapy is proven to be very therapeutic, especially with dementia. And even we've seen here at a center that the elders who have never painted in their life, they thoroughly enjoy. And though they have difficulty with attention span, they sit for 30 minutes and do one art piece. It's so much of joy and excitement. And music also, like, definitely, as you said, it stimulates your senses to a very good extent, and they sleep well after these sessions. And definitely, when it is accompanied with behavioral issues, we need to take help of pharmacological methods in terms to by using mood stabilizers, definitely, because that has to go hand in hand. Otherwise, it gets very difficult because counseling generally doesn't help. You cannot really counsel elders with dementia. So it's the balance of both. And I would again stress that a routine, a consistent routine really helps, even if a caretaker is there at home taking care of an elder. And probably choose a specific place.
If I can interrupt, you brought out many important ways by which, without medications, you can take care of an Alzheimer's patient. Would you apply those principles into this background of coolie? We don't use the word coolie so much anyway, laborer, who's probably doesn't have work every day, but let's say he's getting at least 300 rupees per day. How would you, in this village situation, I know it's hard because we are not living in villages, most of us who are here, but can you just, out of the top of your head, or anybody else, using what Firdaus has told as this community participation, getting together, how would you do it in a village?
I mean, neighborhood is what is very strong when it comes to rural communities as compared to the urban families and communities here. So we can probably help the neighboring, they act like a family. So taking some help from the friends and community, neighborhood people to probably join hands in this process, like
very good idea.
Come and meet. Yeah, come and meet this person.
On so many people in the neighborhood may have not just Alzheimer's, but some other problem. So
yes,
you mentioned about the daycare. Can you organize a daycare in a village? I think you could use community centers. Like, does a village have a community center? No, but it's got a temple. Every village in India will have a temple. So I have seen in the temple surroundings, there was one of the older people who had actually been a performer in festivals. And so these people got him to perform. He was a comedian. And so all these old people would be gathered together and he would make them laugh and have some music. So you see, it's just, there's no limit to what you can do. You can think, once you have the principles, as she's pointed out, to take them out of their daily routine and mix with people, peer support, and do some activities, you can find a solution. But it requires activism. It requires using your common sense. And then you must have the will to do it. You must like old people. This is something I want to stress about. I think for those, you probably love old people, but I want to talk about a particular doctor whom I was learning under. And I said, and this again was in the UK when I was doing my training, and I said, Miss So-and-so, how did you get into geriatrics? This was a long time ago when geriatrics was considered, if you couldn't do anything else, then you did geries. You see, if you were not good at cardiology or something, then you went to geries. So I asked her, how did you get into it? She said, you know something? I just love old people. And I said, what is it that you love about them? She said, I'd much rather be with my old gentleman here. My baby, it's very difficult to burp my baby. And then she drools all over my lovely gown. And so, it's so much nicer to be with so I mean, she was just being facetious. And she was showing that you can actually love an old person. If you think of them in a different way, they are so grateful for anything. I'm sure you have seen that. So grateful for anything that you do. All they want is some touch, a smile, and say yes. And
Yes,
so
that's it.
you can only do that if you tell everybody, show to everybody, even no matter how busy you are, that they woke up that morning just to be with you. And you actually have many other people you have to be with. But if you can spread that, so it's your attitude of the person. We have to get that attitude and show our older people that they're really lovely people. And,
I mean, just one thing I would just point out, when it comes to this stage, and it's like the childhood repeats. And the kind of expectation they would expect from the other person is the same what a child requires. Active attention.
Which is what? Active attention?
Active attention. When you talk to that person, just a smile. Your gestures play a very important role. You smile at them, you get an immediate, it's very contagious. You get that warmth, you get that trust. Oftentimes when we are adults, right, we forget these things. And
yes, and the other
that's
thing,
what is matters.
not to contest. Older people with dementia, they constantly say, I want to go there, I want to go there, I want to go there. And what you're trying to do is drag them back. No, don't do that. Let them do what they want. I mean, I'm not saying let them harm themselves. You say, oh, you want to go there? We are going there. But first of all, we're going to go and wash our hands. Or first of all, we're going to have a cup of tea. And they say, but we're going there. So once you take the person away, they've forgotten that they wanted to go there because they have short memory span. So these are some tricks. And the other thing is validation. I'm sure you use that. Yeah. If they say this is so-and-so, and it may be the wrong person, don't say it's not. Oh yeah, it is. So don't contest them. And what you see in families is people say, it's not like that. It's all wrong. You can't eat this now. But the person wants to eat rice now when there's chapatis. So what do? So you have to have ways of circumventing that. Or they want to go, you want that old person to have a bath. That old person doesn't want to have a bath now. But for you, it has to be a bath now because you've got other things to do. So you have to understand this person doesn't like having a bath. So, this whole thing that Firdaus was pointing out, the behavioral aspect requires a very empathetic person. And I think we must train social workers, family members have to be trained how to be nice and friendly and lovable to the people who have dementia. And of course, there are medical aspects. Yes, so how are we getting along for time? I think we have about 15 minutes more. And are there other aspects that you would like to talk about in this particular scenario? How would you improve the person's finances? Not getting a pension. You know, many of these things, a lot of fanfare, widow's pension, and then it's good. But in Tamil Nadu, we do have a very good widow's pension. Sometimes somebody steals it, but now the Aadhaar card and all that is difficult to steal. So a little bit of activism has to be there. And for the pension. Otherwise, you have to use other methods. Yeah. Any other aspects? Nutrition. This person needs good nutrition. Very hard to give good nutrition to a person who is in such poor socioeconomic groups. But there is something called Annadam. In a village, you can have, everybody donate one handful of something. So if you can get community resources and produce, food for older people, distribute it, and the point in elderly people is the nutrition has to be very good, but there's so many barriers, starting from edentulous person who can't chew, who can't swallow, and then there has to be excess protein. We have to give a lot of protein. In a vegetarian society, giving high protein is a challenge, and protein is the most expensive foodstuff. But we have to look at our own resources. So can anyone tell me what you would do in a village background, poor people, to give protein to this lady? You can't give her milk. It's too expensive. Anyone knows the cost of milk? Eggs. Anyone know what one egg costs? And she may be vegetarian. What would you give? Darshana. Darshana's thinking. Yes. Groundnuts. How can an old lady with no teeth eat groundnuts? But that's the cheapest protein you can give. Of course, got lots of fats also. So now that's food for thought, literally food for thought. Groundnuts. You can make so many things out of that, palatable even for an older person to swallow. Okay. And if she's got good teeth, oh, wonderful. The sweets made out of peanuts is wonderful. You can boil peanuts. In the South, they boil peanuts and eat them. So, basically what I'm trying to point out is caring for older people is, you have to be very astute. You have to think out of the box. You have to think of the most easily available and cheap solution. But cheap doesn't always mean it's not good. Cheap and best is a very good policy. Cheap and best. And yeah, so I hope all the housewives here, all the men here who like cooking, I can see Muhammad Suhail is very, you have some idea about this. Suhail, would you like to tell us something about, is it the peanuts? Is it that you're a peanut fan, or what would you do? You're muted. You're muted. Can you unmute? We'd really love to have you speak. Yes.
Yeah, here in Kerala, in Kerala, we have neighborhood networks in every villages. So in weekly we gathering together all the people, and we have some volunteer students. So we gathering that day, and it's like a rehabilitation program for old age people.
And
So
are you
they,
involved in that? Are you involved in
yeah,
that? Are you involved in
yeah,
that?
yeah,
Wonderful.
yeah.
Wonderful. You
Uh,
Kerala is
some people,
always up ahead.
yeah. It's mainly it's upon every panchayat and in every villages. We have a small group of communities. So we gathering in the evening sections. So we do something like rehabilitation. We gathering together and make some foods just like that, and we eat this from simply. Sorry.
No, it's very interesting. Yeah. So
So
there's a lot of
we
work
have,
going on there.
but it's not applicable in all over the areas, but some areas like some small villages. That's like,
But
so I'm
somebody
from
thought of
actually
that
I'm
idea and did it, you see, and it may or may not be replicable in many other areas, but somebody else may get that idea. So how do you spread this information? Because frankly, it's not just the government's job to look after the old people. India has the largest number of, older people. And I think it's at grassroots level. If you have this principle which Firdaus was talking about, you can use that principle in many, many different ways. And yours is an excellent method of getting the community together, community participation. That's great. Yeah. Thank you. Thank you.
actually I'm from Malappuram, Kerala. We have lots of community peoples in every panchayat. That's like palliative clinics. In every panchayat, we have more than 3 palliative clinics. It's in every area.
Yes, yes,
So
yes.
the
How's
main thing
the
is that
availability of narcotics, though? I believe, though you have such a good palliative care setup, the availability of narcotics is not so good. Is that better now?
yeah, it's not much
Metformin,
better.
morphine.
It's better in the
Right.
because of the people know about the palliative care, the importance of the palliative care. So that's why we can easily access everything, and we for donations and everything, for volunteering, for donation, everything we are accessing.
Advocacy is important. People know
Yeah.
their rights and then they can fight for that collectively. Very good. Yes. People should hear the Kerala story. And of course, Dr. Rajagopalan is from Kerala. And so he has been able to spread it there, these concepts. And they should spread all over India also. Very good. Thank you. Nice stories. Yeah. Community kitchens is another thing that could be done. We have that system of donation. So we could have these community things for certain groups of people. Yes, I think if there are no more questions, we can close this session. We have reached the time. I thank all of you for participating, and those who did not say something, at least you were here to listen. And that's a great thing. I hope you got something from this. Somebody has put, chat, nuts, sattu, fantastic. I hope all of you know it's from Bihar and it's gram, which is roasted, extremely high protein and very, very filling. And Indra Chaudhary has said, dal, purpose. Very good. Yeah. We can think. Nobody said soya yet. Why is that? Nobody likes soya.
I did think of soya, doctor, but I didn't know whether in the villages they would eat it. That was my.
You're right.
Otherwise, soya is.
No, but you're
very
absolutely right. Though soya is so good, it's not really native to India, but it's come to India now and it's freely available. We grow it. But somehow the Indian palate is not very used to soya. It's so much used in the, in the Far East, but not for us. So I think people have tried, but you can make very good recipes out of soya. It just has to percolate through.
Doctor, does soya also have allergenic properties? Because not everyone takes kindly to soya. This is Aparna Prabhu.
Yes. What did you say? Does anybody have?
Does soya have allergenic properties? Because not everyone takes kindly to soya. They usually have GI issues, those who are not familiar with soya.
I really wouldn't know about that, but I guess some people would. Again, that's not something that we are brought up from from childhood. So, but I've been asking people, I've been asking dietitians, why don't you have recipes out of soya? Well, maybe we just don't like it. And then this.
Doctor, this is Lakshmi here. I have posted 2 questions in the chat box. That was whether we have any helpline numbers to
Yes.
connect any older
Yes.
people, or
Oh.
if we see any abandoned people in the known circle or
Pallium
in the
India
road.
has. Pallium India has. We would ask them to give us those numbers, and carers can phone into them. Is it called Sukh Dukh?
I'm not talking on only on Kerala, because
Ah.
Pallium, I think, is operating mainly in Kerala, and it's.
I don't think it would be widespread, and I think it's up to us to do that. But Pallium India is pan India actually. It's not just in this thing, and we can ask them.
I'm aware about Pallium India. I am the volunteer of Pallium India
Okay,
also.
okay.
So I mean, like any child, like number, like the 4-digit numbers or 3-digit numbers. I just want to know whether if you have anything. And another thing is, this many of the hospitals, we don't have a geriatric department. So is there any list available or any website we can see which all hospitals are having geriatric departments available? Is there anything like that?
You
as
know
a
something,
repository?
you've brought out a very important problem. Geriatrics is in its infancy in our country. I mean, I feel ashamed to say this. I'm one of the earliest people who joined geriatrics. You know, in 1996, I went overseas and had training. Now, the government has done so many things. There are medical colleges, only few. I think there are only about 10 medical colleges which have a geriatrics course for higher education course. But my firm belief is you do not need geriatricians to look after old people. The family medicine, who are also scarce, must be taught how to deal with older people so that it's at grassroots level. This knowledge, this, you know, older people, a general medicine person just has to reorient and learn a few different things about older people. And I'll tell you one thing, geriatrics is something which needs a multidisciplinary team. So I think, Lakshmi, you're a social worker?
No, I am a volunteer.
You're a volunteer. So physiotherapist, social worker, volunteers, it is a multidisciplinary team. And the doctor and nurse, of course, is just actually a small part. If much of health and social connectedness can be done by other people. But you're absolutely right. There are very few geriatricians in India, and it'll take a while. And the health system is not geared towards the elderly people. At the most, what they do is separate queue, mobile, HelpAge India has mobile clinics, but actually we need a complete revamp. We need social workers who can go out into the community, who are trained in how to look after elderly people. I think it's still a work in progress, and I don't know how long it's going to take. Ayushman Bharat, have you studied? If you see Ayushman Bharat, which is the way the health mission is now called, they say community-based services, and we'll have a common health worker for elderly, and we will train that person. I don't know. It's going to take a while. But we all have to push for that. We're not in a good situation.
Yeah, thank you. Thank you. And I have heard Tata is having some good fellows or some group who are also working with elderly people. So this is operating only in Mumbai, or they are available in other states also?
Which one? Which one? Mobile clinics?
No, good fellows or good citizens, they have a group. Tata has started.
These are, you know, like Dignity Foundation, Nightingale Foundation. These are all private organizations which have started up on their own because the government scene is so bare and deficient. So private systems are coming up now. Also, profit-making organizations are seeing elderly as a group from which you can earn money. And so they are giving all kinds of services, and we really need to discourage them. We need to have a low-cost way of treating older people. It can be done, but we just don't have those models, and we need to do that. I'm hoping that I can start something. I'm going to start something in 2 weeks' time to prove that you can look after older people in as low-cost way as possible. But it requires the help of many people. We need more models. We need more models. And you, I think, are one person who is an activist in that. You should also work on that.
Thank you.
Yes, Firdaus has said summed up in the chat group. Physicians, nursing, therapists, psychologists, nutritionists. But, this is the Western model, that you have experts in different fields looking after an older person. I think we have to have an Indian model in which you can have a common person, one person who has these many skills. You can't have all those skills. But if you can have a social worker who knows a little bit of the common physiotherapy to be given, how to counsel, how to give advice on nutrition. You don't need an expert in nutrition. So I think we need one person, just like we have the ASHA. All of you know about the ASHA, who is mainly for the maternal and child health. But like that, you can have a person, because elderly numbers in India are so much that they do require a single person to do this. But the training for that has to be very good, very good. So I don't think we should go for different groups of people. We should have one or two people who have multiple knowledge in various areas. Are we doing for time? I think we've exceeded our time.
That's completely okay, Prof Alka, because it is not every day that we get to discuss things like this.
Okay. So anyone else wants to talk? Say something from we've had some fantastic contributions from Suhail, from Firdaus, from Lakshmi, showing that, I tend to be a pessimist. I always show the bad things. But these are all the wonderful things that are happening. Maybe they are happening in small areas. All you need is for it to become a movement for elderly. And that's all of you actually in your own areas. I look forward to people having their ideas. And even when you go away from this course, if you can feel empowered to start something, no matter how small it is, it would be perhaps the catalyst to other people thinking about it and doing so.
Ma'am, you were talking about the financial support, how we can do. And being a volunteer for Pallium for more than 5 years, and we generally volunteers come forward and contribute to various projects which are done by Pallium. So I am aware about such things or how it is being done. So from a personal level, I just try to raise some funds, which is not a beneficiary of Pallium, but since I know how the model works, and it is very difficult to approach again the volunteer group who is already supporting various projects of Pallium, I implement that model myself in my circle.
What did you do? What did you do?
I have a circle of friends. I was in Gulf working for some time. So there are some people who believe in me and they know what the work I am doing and they have the faith in my integrity. So Ashla, Ashla is the person whom I am regularly in touch because she always gives me a lot of hope and she always comes up with a solution. So with Ashla's support, I have tried to find a rehabilitation for one of the girl who was in Kochi, and she needed some support of while doing the rehabilitation. Also, they needed some tools to be brought. In addition to that, some around close to 25 to 30,000 we need to pull up. So we have managed to approach different people. Me along with one more girl. She is the one who is based in Kochi. So we are known to each other through PMI India. PMI is having a Kerala chapter in Trivandrum. So we both are associated in PMI Kerala chapter, and she brought this case to me. This lady has a girl who is a 41-year-old. She is having some mobility issues. So this mother tends to put her in the chain when she comes for her work.
Put her in the
chained at home. Oh. So this PMI friend, she used to observe this lady is taking intermittent breaks, and she just went and asked, what is that is taking so much of breaks during this period? So she told, I have to go home because I need to help my daughter doing her primary things and give her whatever she has because she is in chain. So this is a situation where she connected with me and she asked what we can do to support her. Still it is going, but first phase we have sent them to some rehabilitation center nearby their place. But the problem is this caretaker lady is single and she don't have a husband. So she has to be away from her work, which takes away all her income. And to be with the rehabilitation place, they have to stay there for more than 1 month or 2 months. And even they have so many patients to be accommodated like this. So they can't continue for unlimited time, but they were accommodating her. There were improvements. And later they advised her to come back home and continue the things. Again, there's a challenge. She has to go back to work. And how come she can do all these kind of things? But at least this crowdfunding I was able to do and support her along with the other friend. So I just wanted to say that, we can say that we should not do that level personally. But again, the question is if some situations are coming in front of us and
You
if
can't
we
ignore
really,
it. Yeah, you have
we
to.
can't ignore it. And sometimes I cannot sleep. This is the one thing which is running in our mind till we find a solution for it.
So we have to think of solutions at an individual level, and we
Yes.
also have to think how we can generalize it and make it more convenient. Or this is
Yes.
a terrible story that you're telling us about this lady trying to manage by chaining the person
Yes.
so that she does not
I
harm
actually
herself.
tried to tell her that she can come to Pallium India main hospital and admitted in our halfway home. But the difficulty here, they are under a lot of peer pressure. The person who will be able to take a decision with us today, tomorrow she will be told by some MLA or some community person that no, it is lot of risk associated. Don't go to Trivandrum. You are away from your place. You cannot get help. What will you do? So then the difficulty is that we are away from them. We are not associated with them for a long time. So their decisions get influenced in many ways.
Yeah, this is hard, but solution has
So
to
you
come.
all, I will request, this session is okay, this program is okay. But in India, a lot of things has to be done in this palliative care, and you all should carry this and spread this word. Like whenever I go to any hospital, whenever I consult any doctor, I keep a word about palliative care. I ask them whether you have a department for palliative care. Your doctors can get trained in palliative care with our group. So this is what I do at my level.
What do they say?
What they say, that is not in our control. What they do is not in our control. But what
Your
we can
job
try
is
to
spread the word. Very good.
Even we have a health center in L&T, and I'm working for L&T. So I tell my healthcare provider also, my doctors also to about these policies of painkillers making available, make them spreading the word to endorse
Oh,
it.
L&T is a big company. If they can do their CSR for that, that's what you have to. Because one of the things somebody taught me is that while you should look at individual things, you should have a strategy so that you don't waste your energy in small things. Do some one big thing which will spread the benefits to a lot of people. So I think, Lakshmi, you're good with your enthusiasm and your dedication, and you're working as in L&T. You have to go up to the top
You
bosses
don't
and
need
tell
too
them.
much things. You meet Maratha Gopal sir 1 or 2 times in life, you will get all the motivation and enthusiasm you need.
Yes, I
So
wish
I
Dr.
was
Rajgopal.
fortunate to be born in Kerala and Trivandrum in that way. So I cannot help myself not doing that anymore in life.
Fantastic. And Rajagopalan sir wrote a paper, wrote an editorial in the Hindu yesterday. Of course, that was on a different topic. That was on advanced directives and living will. But he has written a very nice book called Walk with the Weary.
Very, yes.
Yeah. If you read that book, he has an immense sense of humor, and it's a very slim book. So even if your attention span is very low, Walk with the Weary. And I'm going to tell Dr. Rajagopalan that if 100 copies are sold after this, he should give me some commission on that, because when I read his book, I said, oh my goodness, I bought 20 copies and gave it as gifts to so many people. So it's available on Amazon freely. It's very cheap.
Yeah,
But
I
you
too
can,
gifted the book to some of my people. These
so
are
as
the
you
small things
say,
which everybody of us can do actually.
yeah. So
It's
as
not
you
any great
say,
thing.
Rajgopalan has that sense of humor and that very, very simple person. And from nothing, he actually brought up so much of change. So while not all of us can be like that, we can at least get some energy from the
Yes.
way he has done. And you have got a lot of energy, Lakshmi. So nice to listen to you.
Okay. Thank you.
Thank you, Nidhi, for bringing up that case. It's a real case or a fictional case? It's a real
Rare
case.
case, ma'am.
Real case. Very sad situation. So I think you can get a lot of advice from Lakshmi, from Firdaus, from all the people, your team members here. But first of all, you have to identify all the issues that you've already done. And one thing in elder care, if you can improve in all the problems a little bit, you may not be able to sort everything out. But small improvements in all the things you identify. First of all, you have to identify, can make a quantum improvement in the whole quality of life. That is one thing I find if you look just at the medical part. I'm not talking about the social and other. For example, a person who's not able to control their urine, they're incontinent. Well, it's because he's got these bad knees, his bladder is weak, he's got so many issues. He can't see, he's got poor balance. So you can put a light switch somewhere and you can bring the commode near him. He can't go to the commode, so bring the commode near him so that you can't cure his knees. They're gone. So when you can't cure, you have to care. So care always. So if you can keep him dry, you've achieved something by doing small little things here and there. And so I think in the general life also, this will hold true. You can't give complete nutrition, but if you can help a little bit here, mobilize a little bit, have some peace and harmony, all these things work together and make a quantum improvement in the life of the person. So it's a multi-pronged attack. I used to refer to geriatric care as, we think, oh, this old person is
I
doing
wanted to ask one situation in this Nidhi has presented. She is having that elder daughter. I would like to think like Pallium India used to do a rehabilitation program, like helping them having some kind of an income for the daughter. Her husband is working as a coolie, but what is about her daughter doing? Can she have some income being made by sitting at home, making any kind of things, having a small shop? And one time crowdfunding for such things will not be so difficult. That we can do by raising, because we also in volunteering group, we don't have too many people, we have almost close to 50 people. This 50 people used to raise up funds for many things. We can conduct food festival or different things, so we can reach to our own teams, our own friend circle, our own,
or just small industries, because all her time is going in caring for her mother. So she could do some small things even and
yes.
distribute in the village. But these are not things that you can just do it out of the top
No,
of your
it can be some soap making, candle making, pen making,
No,
something
even
like that.
pickles, if you're
Yeah, pickles.
pickles
Pickles.
and because
In
housewives
Kerala
are very
also we
good at
have
that.
many people under palliative who are palliative beneficiaries. We have rehabilitated such people. So if you can connect with them and ask she has any such interest or skill sets, so or even stitching something and selling or these kind of things, we can help them initiate first lot of things to get solved out. If we give them their assurance that first lot I will take, please go ahead, 5,000 rupees generation I will manage, even somehow or other we will, that gives them some motivation.
Or join up with another person. Join up with another
yes.
person.
And once you come inside, how I have seen is I have seen a post in LinkedIn of a wheelchair-bound person, bed-bound person. He is living his life by making seed pens. Seed pens costing 8 rupees. So many people have told the best
What
of
is the seed
good.
pen?
His name is Shaji.
What is seed
So
pen?
seed pen is something eco-friendly pens, which is also having a seed inside its end. So there
Oh,
is only that tube which is made of plastic. Rest all are in paper. It can be made with hand. So I have seen this 8 rupees pen post is seen, and many people have liking, commenting for best wishes and all. I have posted at LinkedIn. Okay, why you are liking and commenting? Buy 10 pens. That makes a difference. And after that, every year I order 100 pens with him. And if I use something, I give to some people. There is not a big amount, but it gives him an income. And then I tell him, if you have any difficulty for income, you just tell, I will order some pens. I will make some people buy it out. But the problem with corporate is corporates always does CSR, but they all have some business motives in that. They don't do anything without any proper motives. I have been running around with different people, but nothing has worked. But that is okay. Whatever we can do in our level, we can always do. So
sure.
these are the small things which I was just sharing with
Very
Nidhi.
nice. Very, very
You
uplifting.
can
And
just Pallium India
motivation.
has lot of such rehabilitation programs. From them only I have seen the models. Then I do it by myself because every time going back to Pallium is not required. Their resources are scarce. So we can take the ideas and models and we can try to implement it ourselves.
Sure, sure. Very good.
Yeah, I will share my number in the chat box.
Please do. Somebody has asked, in case we come across any elders who need support, they want to get in touch with you.
I can give some ideas for sure. I will tell what I will do if I am there. But
Please
I
share
feel
your number.
everybody will have.
Okay. So, anybody else wants to share? Otherwise, we could close the session.
Yeah, thanks a lot.
Thank you. Thank you, Lakshmi. That's so nice to hear that.
Thank you, Professor Alka, for joining us and leading that wonderful discussion. Everyone was very, very interactive. The case also was very relevant. Thank you so much, Nidhi, especially for that. Thank you, everyone, for joining and making the session interactive. And we hope that this helps to bring out a change in at least the life of one elderly around you. That is what we reckon, because a journey of 1,000 miles begins with a single step. I firmly believe in that. So with the promise that we'll be meeting again in the next session with yet another important topic and another eminent speaker. This is Sri Priya along with Professor Alka Ganesh signing off from the Tips Eco Hub. See you in the next session, everyone. Till then, take care. Keep spreading happiness. Bye-bye.
Bye. Bye.
Thank you, Priya.
Thank
Thank
you.
you all.
Thank you, everyone.
Enjoyed it.